Hi Kay. Sorry I'm sending this to you late, honey. I really appreciate you reaching out to me because I never would have looked at that and realized I had the wrong thing up. So these are the instructions she has. It says verbalize understanding of normal ranges and interventions as they apply to newborn, infants, toddlers, school-age children, temperature, heart rate, respirations, blood pressure, and it says discuss least invasive to most invasive and contraindications for various methods of assessment. Sorry, that was a mouthful. So I will start with heart rate. So for the newborn, they kind of like they're higher numbers for most of their vital signs except for blood pressure, and it gradually decreases with age. So for the newborn, the heart rate can usually vary between 80 and 150 beats per minute, and you can even get as high as 180. Toddlers 70 to 120, preschoolers 60 to 110, and that's kind of the same for school-age children, and adolescents 55 to 95, which is more aligned with an adult. If they are younger than 10 years of age, you're going to auscultate their apical pulse, and if they are older children, you can use the radial pulse. You're going to palpate the radial pulse. Temperature, infants are a little bit higher, and that's okay. So they range from 97.9 to 99.7, and then like once they hit 5, it starts to level out to 98.6, which is that of an adult. The different methods for temperature, so there's the tympanic, which is the ear one, and if they are, if they're infants and toddlers, you're going to pull back and down, and if they're preschool and older, you're going to pull back and up. Oral is the most reliable after age 5. You really want to try and avoid rectal because that's so invasive. Temporal is a great method for any age except for infants that are less than 90 days old and are sick or ill, or feverish. Auxiliary is a great method as well for infants, and you just got to remember that you take you add 1 to the temperature because you're losing that from body heat. I don't know if I said that right. What's next? Respirations. So the infant can be as high from 30 to 60 breaths per minute. Toddlers 20 to 30. It just gets lower. So preschool, school age, it's like 20 to 22, and then adolescents, it's more like an adult's range, so 12 to 18 or 20. Blood pressure. So blood pressure is actually really low in infants. It can go as low as 70/40, which in an adult, that would be like a cause of concern because it could be hemorrhage or sepsis. But by 10 years of age, they start to even out more towards like an adult's blood pressure of like 90 to 130 over 60 to 90. What else? Pulse ox. I don't think they said pulse ox on there, but I just know that it needs to correlate with the apical pulse, just to make sure that they're getting the right oxygen saturation. And you can use like a finger, a toe, the forehead, the ear, as long as you're avoiding an extremity with a blood pressure cuff or an IV line. I think I covered all of the vitals. So least invasive to most invasive. What I understand from this is that you want to do as much with the child as you can with clothing on, with the parent, have the parent hold the child. If you can listen to their heart rate under their clothing without taking anything off, that would be the best method. Also, rectal route is always the most invasive. You want to try and avoid that at all costs. And like with kids, you want to make sure you're using different terminology. So you're not going to say, I'm going to take your temperature. You're going to say, let me feel how warm you are, or see how warm you are. Or for like respirations, I want to listen to your breath. I think that's it, Kay. Please let me know if you need anything else or if I said anything inaccurate. I really think that's it. Okay, I really appreciate you, and thank you for keeping me on track because that would have completely went over my head. I think the only other sign-off I have to send to you is the DocuCare one. But that's also kind of confusing because Ms. Shanahan said today that we're going to screen share with her when we do that So I'm going to ask her to clarify that, and then I'll let you know. All right. Thank you so much, Kay. I hope you're being safe, and I'm sorry you can't go to Dairy Queen. All right. Bye.